Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Said, my son is one of those hardcore cases. Every day is a battle. He is 22. I feel like I have tried everything and that everyone has given up on us, on him and me. My choices seem to drop him off at a facility that I don't believe to be reputable or to simply take the chaos that is my life. We don't sleep. We live in fear of another outburst. He communicates with an iPad, but it is not unusual for him to break his own iPad. I have 4 in the shop being repaired right now. I don't believe that anybody understands. They didn't really ask a question, but I see, and this is not the only time I've heard this from a parent who's in dire, that they feel like it's black and white. It's either I just shut up and put up with this, or that I sign the papers and put my child into a facility where I have no control over anything, and I fear for their life and my life, and that there's no area in between. What do you want to say to this parent, Dr. Granpeesheh?
Oh my God, that makes me sad, Shannon. You know, what you just defined, what you just described, hopelessness, right?
Yeah.
Hopelessness is depression. So what I want to talk about is the parent first. That's what I'd like to talk about first. There's many things here that have to be unwrapped and dealt with, but the most important thing is, if you are depressed as a parent, which honestly, a lot of our parents have the absolute right to be, because life is overwhelming, even if you don't have a special needs child. When you do have one and it's a severe situation that others are not there to help you, yeah, I mean, it's natural to be depressed. And so I want to take care of you first, because you have to be in a good place to take care of your son. And there are solutions. It's not, you will not be the person to take care of him for the rest of his life. Like, let's just start there. But right now, in order for you to gather the resources and you know, put together the village that's going to help you with your son, you need to be better first. So we need to get you to see a psychiatrist, get you to take some antidepressants. And I'm really being very honest about this. This is what I would do. And get some help, like get psych sessions, if you can get therapy, if you can get on some medication, which is not a big deal at all. Help yourself, get family in, not to take care of him, but to give you respite so you can take care of yourself, just for a short period of time. And if you don't have family or anyone that you can, you know, maybe you can hire people who can just come to the home and stay with him until you go have a therapy session. You get enough sleep. Okay, sleep is very, very important. It is extremely important. And I really, really ask of you to try to help yourself first, you know, and this is a type of case where, I don't know, hopefully you have the resources. I mean, some of our parents go to the local church, and church groups will come and help. If you need financial resources, I would suggest that you write in to ACT Autism Care today, and we will try to get you a grant to try to get you some respite. Because, and actually, depending on where you are, respite is usually funded.
Yeah.
So really, I want you to try to focus on yourself first. Okay. Now we're like a month later, and we're in a place where you are able to wake up in the morning and not think right away there's no hope, right? Well, the hopelessness has become maybe there's 10% room for some hope. Something can improve here. And then these are the things you want to do. You need to first of all, then you need to get your child, first of all, your son, in to see a psychiatrist and get him on some sleep medication, period. Like, when it's this severe, this is no joke. Like, we got to get him sleeping at night. And that is probably the most important thing you can do for his health and yours. Like, there is no question about that. And if you are seeing a psychiatrist for sleep, then there are also medications that help with the I don't it's not aggression really, it's like his frustration level and his, throwing or destroying his iPad or whatever it is. But I honestly, personally, I think a lot of our adults who are extremely frustrated, part of it has to do with the fact that they're not sleeping. I mean, if you don't sleep, if I don't sleep, I'm going to be a pretty mean person to deal with all day. I'm not going to be happy. So sleep is a very important, that's the first thing I would focus on with him. The second thing is, it doesn't matter what age your child is, 20, I think you said 22 here, Shannon. It does not matter if you have health insurance or even Medicaid, you can get ABA, you can get applied behavior analysis wherever you are now in the States. And there are individuals who will spend time with him, teaching him how to communicate on his iPad, how to spend time in leisure activities, how to take care of his adaptive skills, how to all sorts of stuff, right? To the point that, and they can be there a lot to help you. Like, you will have free time when this individual is there working with your child. And so what you've done now is you've taken care of yourself, and you have now found individuals who are able to come and take care of your son, and both of you are sleeping, which is super, super, super important. Now, a month after that, now you can start fine tuning, and now you can start looking at things like, I wonder why he's aggressive whenever he eats this. And maybe I need to tweak his diet, right? Which is a whole nother thing which will help him. I wonder if there's like a way that I can put him in a social environment where he's going to enjoy that. There's a lot of other stuff that you can do on top of it, but if we want to kind of keep it in order, I think the survival mode is you take care of yourself, you make sure you're feeling okay and sleeping, and then you get him to a point where he's sleeping, and then we start to teach things. Does that make sense, Shannon?
It makes total sense. I think prioritizing and saying the first thing that happens is that we got to get help for the mom. I've never been in this kind of a situation, so I want to make sure that I say that. But when there was a period of time when we started ABA, where I was like, what's going to become of us? I
Mhm.
couldn't see a light at the end of the tunnel. And I remember when we went to start services for ABA, they made me make a list of what I wanted to work on first. And there were three things I was like, I don't even have to think. They were like, take this home and over with your husband and think about it. I said, I don't have to think about it. My son hits his head on the kitchen floor whenever stuff happens. I need you to fix that, or he's going to have applesauce for brains. We don't ever get sleep until 3:30 in the morning after driving him for 2 hours. We need to fix that. Oh, and by the way, I want you to, he could talk once and now he can't talk. So can you do that as well? I sort of right into working on the talking. I don't know why, but that was my feeling. And what they came back and said to me was, so the first thing we're going to work on is the sleep. And I was disappointed. And I said, well, like, maybe we should work on the head banging first. And they said, quite honestly, we have an intervention for the head banging, which we're really confident in, but we don't think that you're well rested enough to do it. So
Yeah.
we have to get you rested first, mom. And what was interesting about that was I would never have prioritized myself. Not in
Yeah.
a million years. I'm
Yeah, we
still
can't.
struggling with it now.
We can't.
Right.
When there's something wrong with our kids, we cannot prioritize ourselves. I know.
But the fact that they said to me, we can't do the intervention for banging his head till you get rest. So we're going to make it so that he sleeps and you sleep first. I was like, okay, then let's do it today. And of
Yep.
course, within 3 days, and it's still to this day, can I tell you, it irks me. Within 3 days, they had him going to sleep at 8:30 at night, where for the 2 years before, I was up till 3 o'clock in the morning. And and to be honest, and I always tell this therapist, it made me mad Because if it was that easy to do, then why had nobody told me what to do before? And I had tried so many of the elements of what they did. I just didn't do them all together in the right format. It ticked me off. But then they got the head banging under control, and then we very slowly started to work on the talking. But but on that first day, I didn't have enough together. I was too underslept to really understand what it was you guys were saying to me. So for this mom, I'm thinking my son was 3 on that day. And
That's kind of what I wanted to say. So I'm glad you mentioned his age. It's one thing to work with a 3-year-old and behaviorally to get him to sleep. It's another thing to work with a 22-year-old to get him to sleep.
And also think about how many more years this mom has gone without sleep, and how many more years this 22-year-old has had a pattern, and how much more hopelessness and depression that there would be. My son was 3 and I could pick him up.
That's right.
And I thought it was the end of the rope. So I can't even imagine for this mom. But I hope that she can prioritize getting herself and listen, I'm not a big one for the medication route. I really am not. But I understand that when you go this long for depression, your body literally can't make the stuff to make.
And also, I mean, that's why, I'm a behaviorist through and through, but I recommend medication in this case. I often do for my older kids, because when you have an adult, when you have a 22-year-old patient, you can't mess around with it too much. You need a little bit of help. Because if he gets angry and tantrums, you know what's going to happen. Everyone's going to back off because it's scary. It's one thing for a 3-year-old to tantrum.
Right.
It's another thing for a 22-year-old. So there's really nothing bad about having some medication to help you. And in the future, if you want to get off the medication, or if he wants to get off the sleep medication, that's a whole nother phase that we can work in. But honestly, right now, I just want to get you urgent help.
That's right. That's right. And I feel so bad because I know this mom writes and says, I feel like he's given up on us, on him and me. But there is help. And in almost all states, there is a system of help and a group of people who could help you with the respite and with other things. If you don't know where to go within your state, if you literally don't know who else to call, I would tell you a couple of things. You can reach out to the Autism Society that is local. And it will take them a while to get back to you, but when they do, they will know what resources you have there. And if that is too much for you, please, will you do me a favor? Write to me and I'll reach out to them for you. Shannon at autism-live.com. So let's just say that and put that out there. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.